Hi, I'm Rob Archuleta. I'm the Chief Innovation Officer here at Crossroads Turning Points.
I'm Jessica Alfaro. I'm the Senior Residential Supervisor.
So today we're going to talk to you about the STAR TC program. I'm not even going to try to tell you what STAR stands for because I keep messing it up. So what does STAR stand for?
Sisterhood Teaching Alternatives for Recovery, Therapeutic Community.
Okay, so you have on this paper that it's a modified therapeutic community. What does that mean? What does modified mean?
So when it's modified, it means that the focus on the clients is really therapeutic. We try to stray away from that punitive viewpoint that past TCs have utilized. It's about a 6 to 9 month program, so it's shorter than other treatment programs in the TC model. And so we try to get things done faster, but in a more therapeutic way.
So also TC is peer driven, and sometimes people have a misconception about that. They think that peer means that the clients run the program. And what does peer driven mean?
So when it's peer driven, clients also hold each other accountable while in the program, but really it's about the client and how fast they make it through the program based on their progress in treatment.
Okay, and it's gender specific?
Yeah, gender specific. So this program is specific for women. And so we utilize the issues that women have on a day-to-day basis to kind of work through the program.
Okay, and what does this program cost?
So it's a state-funded program, which is really a big benefit for this program. So there are no out-of-cost payments for referral sources or for clients.
Okay, so what if a client comes in and they struggle with mental health, they have criminal needs, and they struggle with substance abuse disorder?
So we have an LCSW who does weekly therapy sessions. We also have a consulting psychiatrist for medication management. And so we have trained professionals to help through co-occurring issues.
What does LCSW mean?
LCSW is a licensed clinical social worker. Thank you for asking.
All right. So you also have on here that it is an ASAM level 3.5. So what separates a 3.5 from a 3.7?
So a 3.5 ASAM level, clients have less medical issues, but they still get the same amount of therapy hours, which is anywhere from 20 to 40 contact hours while in the program.
Okay, 6 to 9 months seems like a long time. So you have on here, you have phase 1, phase 2, phase 3, reintegration, or something like that. It starts with an orientation phase. What does that mean?
So the orientation phase is utilized to learn the program tools and concepts that they use throughout the treatment program.
Okay, so they just kind of get used to the environment and getting used to the structure.
Yeah.
So what is phase 1?
So phase 1, they develop an individualized treatment plan as well as utilizing those treatment tools and concepts that they learn in orientation phase on a day-to-day basis.
Okay, being that the program is peer driven, when you're talking about an individualized treatment plan, what does that mean for the client?
So the client focuses on their own issues. If there's trauma, if there's anger issues, if there is something that has prevented them from remaining sober throughout their life, those are the issues that we want to focus on in that treatment plan.
I think that's important because everybody that comes into treatment has their own individual problems that they're trying to deal with.
Absolutely.
So what is phase 2?
So in phase 2, they utilize everything that they've learned in those previous phases, but now comes the real hard work. They work on those harder, more difficult problems that they've had in their lifetime, but also they begin to look at the future as well and develop life goals.
Okay, so now you've done orientation, you've done phase 1, you've done phase 2. Now you come in and you're ready for phase 3. What does that mean? Or you have a reintegration phase.
So yes, phase 3 or reintegration, that's when they start reintegrating out into the community. They utilize all the tools and concepts they've learned, all of the progress that they've made in their own treatment plans. Now they get to put the action out in the real world and start working towards becoming self-sufficient, such as finding a place to live, finding a job, and doing those things that they've put off for all of the time in their addiction.
So I think that's really important because a lot of these clients that are coming in are on probation, parole, and they don't really understand where they belong in society. And so you're kind of teaching them about social norms. And then in the reintegration phase, they're starting to reintegrate back into society. So are they living in the treatment program or?
Yes, so they still live in the treatment program. They're still responsible to be redundant or let the unit know where they're at all times, but they start learning the bus system. They start working on communication by making sure we know where they're at, and then they start applying for those jobs and doing that hard work.
So, but in the reintegration phase, if I understand correctly, they're living in an apartment now?
Yes, so they do live in the apartment. They move to that last phase of privileges that they earn, and so they have that apartment-like living to where they're responsible for their own cooking. They're responsible to keep their apartment clean, but also have roommates and work through the issues together.
So the apartment's connected to the treatment center, so that way if they still have issues, they always have the clinical team to fall back on.
Absolutely. And then they also come back in and they do what's called give back. So not just abandoning their other peers, but also coming back and still being there to support their other family members per se.
Okay, what clients qualify for the TC program? Like, where do those referrals come from? Can just a mom off the street that knocks on the door and says, my daughter needs treatment, where do those referrals come from?
So a lot of referrals that we get are from parole and probation. We also get referrals from the Department of Human Services or self-referrals. But really we're looking for somebody for this program who has failed other programs or who has completed those programs but still really need that long-term structure and sobriety to continue on their recovery. We try to find somebody with higher needs, whether that's mental health or addiction. So they've had a long history of substance use because they usually have more issues that they're working through.
So if you had to pick one thing that you like the most about the STAR TC program, what would it be?
I think for this program, it's really about support. And there's a saying that goes in the STAR TC program, support is the foundation of the program, and that's really what we're trying to teach these women.
Okay, so if you have any questions about STAR TC, you could go to crossroadstp.org. The application is also on the website. You could also reach out to Jessica Alfaro. Her email is jalfaro@crossroadstp.org, or myself, rarchuleta@crossroadstp.org. My name's Rob.
I'm Jessica.
All right, check out the STAR TC program if you have clients that are needing that help, and we're always here for you. Thanks.
Thank you.